Welcome to the second in a series of 4 screencasts on the prevention of food waste in the healthcare sector. I'm Jessica Twemlow, a technical advisor working on behalf of WRAP in support of the Hospitality and Food Service Agreement. In the first screencast, we looked at why wasting food matters, the size of the issue, and the value of food that is wasted, where the savings occur, and why prevention is key to making cost savings. And we also looked at how you can help by promoting food waste prevention and signposting sources of support. This will help hospitals make the changes and help them become more economically and environmentally sustainable. In this screencast, I'll be introducing some simple actions hospitals can take to identify and realise the cost savings potential from preventing food waste. This screencast will last about 15 minutes. WRAP's extensive sector-wide research shows that each tonne of food waste would typically cost the healthcare sector £1,900. So it is clear that there is significant potential for making cost savings. To work out what potential savings a hospital can make, it is important to know how much food is being wasted during day-to-day operations. So this screencast focuses on undertaking a food waste review to understand how much food is being wasted and where the waste is produced in each stage of the food waste chain. It also looks at measuring and monitoring food waste and using this data to identify the best opportunities to take action and make cost savings. WRAP's experience of working with hospitals proves that undertaking a food waste review can achieve substantial efficiencies, significant cost savings, and staff engagement in monitoring food waste. The results can be used to set targets for food waste reduction and to develop initiatives to prevent food waste. An initial food waste review can show a hospital how much they are currently wasting. This data can then be used to identify practical actions that will lead to food waste reduction and cost savings. Undertaking regular food waste reviews and audits can help develop a better picture of the food waste generated in your hospital, the quantities generated in different areas, why it is generated, and how it can be reduced. This can result in identifying significant savings for your facility. In hospitals, food waste is essentially unseen, as it is disposed of in the general waste bin or using macerators. In addition, in many healthcare facilities, food waste is managed and disposed of by staff at ward level. As a result, catering staff often do not get to see the quantity and type of food waste generated. The review process is designed to be simple and quick and minimise any impact on staff activities. Staff required to participate will include those in the catering department and ward-based staff. The review should take place over a typical period that may include both weekdays and weekends. Waste content and volume may also change with seasons, so the review should be repeated at regular intervals as part of an approach for continuous improvement. It is important that all relevant staff understand why the food waste review is being carried out and what is required of them. We recommend that a briefing session is delivered to all relevant staff. This should take place 2 days before the waste review. It will ensure all staff understand what their roles are and how their actions can contribute to preventing waste. A briefing session will help reassure staff that the waste review will only determine the quantity of waste generated in each area, and that they are not being personally audited or checked. It's also a good idea to appoint a waste monitor to ensure that food waste is being separated, weighed, and recorded correctly. Food waste typically arises from spoilage during storage, during meal preparation, plate waste, and unserved meals. WRAP's research shows the amount of each type of waste currently being generated is significant, but there is plenty of scope to reduce it. So what do I mean when I talk about spoilage? Spoilage is anything from the kitchen that has gone off or is being contaminated and is unusable. This may include items such as melted butter or mouldy bread. It's also important to consider food that is stored in ward kitchens or retail units. Most produce, like fruit and vegetables, spoil or degrade over time, so it's important that stock is not over-ordered, only the quantities required are purchased, and that deliveries of fresh produce are frequent enough. Food orders from fresh ingredient suppliers may also contain spoiled or damaged items. or some may not be as fresh as required and may spoil more quickly. It's always worth checking over the full order before accepting it. Spoilage can also occur from ingredients not being stored correctly, perhaps from poor packaging, cross-contamination, or storing at the incorrect temperature and humidity. If there is poor stock control processes in place, then ingredients may be binned because they're past their use-by dates. Preparation waste is any leftover foodstuff that is wasted as part of the preparation of patient, visitor and staff meals. Some of it will be unavoidable, such as eggshells or banana skins, but even so, it's useful to record this information for future plans to dispose of food waste via composting or anaerobic digestion. Preparation waste may also include spoiled during preparation, such as burnt toast, and it typically includes meat and fish trimmings and vegetable peelings. Plate waste is the food that patients, staff or visitors haven't eaten, and it's usually the consequence of either the portion size being too large or because it's something they don't like. Meals that are returned by patients untouched also contribute to plate waste. This might be because the meal served did not match the patient's expectations, or they refuse a meal as they're feeling unwell. Unserved meals will include food provided in the bulk food system that is not served to patients and left in containers at the end of service. It will also include any unserved meals from a plated food system. This might be because the patient has been discharged or the patient has been taken for treatment during the mealtime. So let's take a look at how mapping food waste can build a picture of where, when and why waste is generated. To measure how much waste is produced, the first step is to understand where food is wasted and segregate the food waste into 4 waste streams. Waste bins will be needed to collect spoilage waste. This will include any spoilage from ward kitchens and retail units, kitchen preparation waste, plate waste. This will include plate waste from patients, but also from staff and visitors in the hotel restaurant. You may also need to consider leftover food from patient snacks outside of meal times and unserved meals. Kitchens are busy places, so another important factor in helping staff to put the right waste from different catering stages in the right container is to position them in the most practical location according to the layout of operations. Using clearly labelled coloured bins makes it easy for staff to identify what type of waste they should be putting in each bin. In this example, purple bins are used to collect waste from spoilage, blue to collect preparation waste, black to collect plate waste, and green to collect unserved meals. The food delivery system should be considered when measuring food waste, for example a bulk or plated food system, and where the food is disposed of, for example at a central location or in the wards. Depending on the mitre space available or the size of hospital, it might be the case that more than one bin is needed to collect the same type of waste. Clear labels or posters will also be needed to provide instructions for staff, and these should be in easy view in all food preparation and disposal areas. Food waste will need to be collected over a suitable period of time to give a true reflection of the hospital's food service operations. Ideally, it should be carried out during the weekday and at weekends. There are 2 main ways to measure food waste. The first involves recording the number of waste containers filled during each meal service, and then estimating the weights from known size of the container. The second involves weighing the containers during each meal service. Bins can be weighed using a simple set of weighing scales. Luggage or fishing scales can be obtained cheaply and are ideal for this exercise. Remember, food waste can be heavy, so it's worth using a container that can be lifted easily and safely. Ideally, the survey should be carried out in a number of wards, or if resources are limited, in a selected ward. The selected wards should be representative of normal activity, or could have higher levels of food waste generated per patient. It's always best to focus resources on these areas generating the largest quantity of food waste first. When weighing meals provided in bulk or provided from the ward kitchen, you should weigh each bulk container of food provided to the ward. This will show the quantity of each type of food prepared for the ward. After all the meals have been plated, re-weigh each bulk container of food and record this quantity as unserved meals. And for meal components supplied in bulk from the ward kitchen, measure the weight of the container before the start of the meal service and at the end of the meal service to determine the quantity of these foods provided. When weighing plated meals, after each plated meal has been provided to patients, record if there are any unserved meals that have not been provided to patients. Ensure that all plates are collected from patients and returned to the kitchen or ward kitchen without being cleared. Collect and weigh this food on the remaining patient plates. The easiest way to do this is to scrape the food into a container and weigh it, and then record this quantity as plate waste. Remember to weigh any plates or bowls used in providing food. This will allow you to determine the net weight of food provided. In many facilities using centrally plated systems, breakfast is provided in bulk containers at ward level where it is plated. Other foods such as cereal and bread may also be provided from the ward kitchen. In such cases, the majority of monitoring will need to be undertaken in the ward kitchen. Therefore, food will need to be measured in the main kitchen, ward kitchens, and hospital restaurant. Also try to collect any unused milk separately. Record and weigh the volume in a jug. You'll be surprised how much milk is thrown away unnecessarily each day. To help record the amount of food waste generated, RAP has developed a handy waste tracking sheet which can be downloaded from the RAP Online Resource Centre. The tracking sheet is structured so the waste can be recorded by either weight or by volume, and it provides the necessary volume to weight conversion factors to make it easy to convert between the two. The results of these measurements will give a starting point or the baseline, and it's this baseline that provides the basis against which the impact of changes in day-to-day practices can be compared. Keeping a record of these results will enable a hospital to compare equivalent data from future reviews so it can monitor progress. To ensure like-for-like waste data is compared, the data will need to be normalized, and this can be done by dividing the quantity of waste by the number of patients or patient episodes. This is key to working out what waste and cost savings have been made, and is useful for setting meaningful key performance indicators, or KPIs for short. KPIs can be used to compare performance, for example across departments or hospital sites. KPIs can also be used for benchmarking to measure a hospital's performance against best practice data. Compare your spoilage, preparation waste and plate waste against RAP's data. For example, 21% of food waste is classified as spoilage, 37% of food waste is classified as preparation waste, 34% of food waste is classified as plate waste, and 8% of food waste is classified as unserved meals. As part of the measurements, it's useful to monitor what type of food is returned on the patient's plate. Unusually high levels, trends or patterns in the types of foods or menus items not consumed could indicate issues with portion sizes or other food-related issues. The observational audit of plate waste, while respecting patients' privacy, requires some assistance from patients in understanding the reasons why food has not been eaten. It is recommended that a designated member of staff monitor a sample of meals served on a daily basis. You should identify the reasons for plate waste by speaking to patients or ward-based teams. Reasons for plate waste may include clinical, for example stress from medical treatment or poor appetite. Assistance, for example assistance was not provided with their meal. Environmental, for example disturbances during the meal service. Meal service, for example poorly presented meals. And food issues, for example food is not served at the correct temperature. In some healthcare environments, it may not be possible to complete this assessment. Even when the reasons for plate waste cannot be determined, the observational audit of plate waste will provide information on the quantity of plate waste. A frequent example of plate waste is salad garnishes. These are commonly served but often not eaten. An opportunity here may be that the garnish is replaced with an offer of a separate order of side salad. The results from the food waste audit will show how much waste is being generated at each stage of the food service. This will help determine what should be tackled as a priority and how much a hospital can realistically expect to save if they change specific practices. For example, if the spoilage rate is high, is stock overordered? Are deliveries frequent enough? Can the stock control system be improved? During preparation, is food being overproduced or spoilt? If a lot of food plate waste is returned by patients, can portion sizes be adjusted and are they consistent? Are there any issues with certain types of meals? Looking at the underlying causes as to why the waste is being generated will help identify the opportunities to prevent it. As we're approaching the end of the screencast, I want to provide you with a few web links for some free online support and advice that you can find on our website. These suggest some quick and easy ways of cutting down on food waste costs. The Online Resource Centre offers some simple top tips on preventing waste within the operations of a typical commercial kitchen. The Hospitality and Food Service Info Finder holds a wealth of practical and proven advice with supporting guidance. Essentially, it's a search and find tool which allows users to find the information most relevant to them. And if a hospital is thinking about recycling food waste, we've got the Food Waste Recycling website with information, advice and tools to help make it work. The Waste Scotland Regulations 2012 requires Scottish healthcare facilities to present their food waste for separate collection from the 1st of January 2016. Under the regulations, macerators cannot be used to discharge food waste to the drain or sewer. At present, most hospital food waste is disposed of via sink macerators or through the general waste collections. In anticipation of this, Resource Efficient Scotland commissioned a report to investigate food waste collection service requirements at NHS hospitals. The report identifies a number of options for hospitals to be compliant with the regulations, including recycling collections, reverse logistics, and on-site treatment or pre-treatment. The report is complemented by a food waste disposal calculator tool, which can be used by all hospitals in Scotland to identify the financial impacts of changing food waste management practices. The report and calculator together provide comprehensive guidance for health boards in Scotland and help them to take practical action to improve their food waste management. There are no plans to prohibit the use of macerators in England or Wales. Well, that brings us to the end of Screencast 2. Now you've seen where food waste arises and how food waste can be measured and tracked, I encourage you to view the next screencast in the series, Screencast 3, which provides some great examples on how hospitals can make changes to prevent and reduce food waste in a ward setting. Don't forget, any NHS trust or private healthcare business can sign up to the Hospitality and Food Service Agreement. Thank you for listening, and please don't hesitate to get in touch by emailing hafs@wrap.org.uk if you'd like to find out more. Goodbye for now.